In general, in specialty practice, every day we're met with patients that have vague signs of illness or very specific signs of illness. And we often have to wonder, could this be related to an occult infection? This paper looks at the incidence of canine vector-borne diseases in ill dogs. This study particularly is taking place in Southern California. However, the information is important for any clinician dealing with autoimmune diseases in an area where ticks are present. Idiopathic autoimmune diseases and canine vector-borne diseases share many of the same clinical and laboratory abnormalities. Furthermore, vector-borne pathogens may initiate autoimmune disease. Therefore, it is important to rule out vector-borne pathogens before declaring an autoimmune process idiopathic. Diagnosis of vector-borne diseases can be challenging despite improved serologic and molecular testing capabilities. This is confounded by the ever-increasing number of such agents discovered. Knowing the prevalence of these agents in a particular region can make diagnosis somewhat easier. Regional studies and published studies of the prevalence of vector-borne infections in dogs with autoimmune diseases are limited. The purpose of this study was to evaluate the prevalence of vector-borne pathogens in dogs with compatible clinical signs in Southern California. Prevalence was determined by PCR and serology panels on acute and convalescent samples to determine if this approach would increase diagnostic yield. 42 client-owned dogs presenting to private specialty veterinary practices in San Diego County with clinical signs of vector-borne disease were recruited for this study. This was a combined prospective and retrospective clinical observational study. These patients presented to the veterinary specialty hospital, and if they had one of the following clinical abnormalities, they were offered to enroll in the study. And really, it was quite simple. They said, you don't really necessarily have to do anything different. We're just going to take some blood. Potentially further down the road, we're going to do some additional testing. But we want to enroll your dog because it has one of these clinical signs, and we want to see if your dog potentially has one of these diseases. So the abnormalities were otherwise unexplained fever, anemia, thrombocytopenia, epistaxis, arthralgia, polyarthritis, ocular inflammation, myalgia, proteinuria, and neurologic abnormalities. And neurologic abnormalities were listed in the paper, but there are a wide range of things, anything from ataxia to vestibular signs. So these were dogs that were coming in before their big workups. So they came in with anemia and they said, hey, potentially this might be autoimmune. Would you like to be enrolled in this study? The only exclusion criteria was that dogs could not be receiving doxycycline at the time of presentation. So there were 42 dogs that were enrolled, and all 42 dogs did have samples evaluated during the acute phase at presentation. 27 of those dogs also were available to have convalescent samples to be evaluated. Testing included serology for Rickettsia, Ehrlichia, Bartonella, Babesia, Borrelia, and Anaplasma. They also did PCR for similar vector-borne diseases. They didn't do PCR for Borrelia or Rickettsia, but they did do additionally PCR for hematotropic mycoplasmas. Acute samples were taken at presentation, and then convalescent samples were taken 9 to 42 days later. Medical records were examined retrospectively for evaluation of documented abnormalities, underlying conditions, and whether there was documentation of tick exposure. As far as the signalment, the median age was 7.5 years with quite a broad range, 10 weeks to 13 years. And there was an even distribution among the sexes between males and females, and both intact and neutered animals were included. There were 10 mixed breed dogs, 5 golden retrievers, 4 labs, and then 20 other breeds I counted that had either 1 or 2 representatives. Interestingly, there was not a single Cocker Spaniel in the group. As far as the prevalence, when they looked at all the tests, the acute, the convalescent, serology, PCR, there was evidence of exposure to or active infection of 33%. So 14 of the 42 dogs tested positive on one or multiple of these panels. The 2 principal vector-borne diseases were Ehrlichia and Babesia. And so 5 of the dogs were PCR positive for Ehrlichia, and 5 of the dogs were PCR positive for Babesia. So there was 12% in each category. For the Ehrlichias, there were 2 E. canis seropositives. The others, they weren't really sure what particular species of Ehrlichia was present there. But the PCR was definitely the better screening test, and the same was true for Babesia. There was 3 Babesia von Gellies that were PCR positives, 1 Babesia gibsoni PCR positive, and 1 Babesia dog was co-infected with Babesia conradii and also 2 hemotrophic mycoplasmas. It's important to note that the Babesia dogs were seronegative, so it's really important when looking for Babesia that you pick the better test. In this case, that would be the PCR test. Additionally, there was 1 dog that was anaplasma positive and 1 dog that was Borrelia positive on the SNAP tests. There was 1 documented false negative on the SNAP, so on the initial presentation, the SNAP test was negative for that dog. That dog was PCR positive for Ehrlichia and also did seroconvert much later on when he had a very high titer. So on the convalescent testing, that dog was seropositive. So again, the PCR was the better, more sensitive test for Ehrlichia. There were many other underlying diseases that were discovered. For example, neoplasia was the most common other underlying condition. There were also a number of infections and other things that were discovered. So of the 42 dogs they initially enrolled in the study, 14 were ultimately suspected of having idiopathic autoimmune disease based on that workup. However, 11 of these 14s were found to have evidence of canine vector-borne disease. So out of this total population, really only 3 seemed to be idiopathic out of that total 42 dogs. So 11 of the 14 dogs that were suspected to have idiopathic disease did have evidence of canine vector-borne disease. And so that's an important thing to note when you're dealing with a dog that potentially has an autoimmune disease in an area where these pathogens may be present. Whether or not a dog was exposed to tick was unfortunately not documented in the majority of records. Of the 42 dogs, only 14 had written in the record no tick exposure or yes, the dog was exposed to ticks. Of the 5 dogs where it said yes, this dog had tick exposure, all 5 of those dogs had 1 or more canine vector-borne diseases. And to me, that says that those ticks that are out in that area are infected with 1 or more of these diseases, and they will likely transmit the disease. So that's really, really important. If we're living in an area where those ticks are present, tick control is really, really important if you don't want your dog to get sick. 9 of the dogs that were reported as having no tick exposure, 1 actually did, and that's not that uncommon. I know in the past with my own animals, especially if they have thicker fur and around like the neck where you might not necessarily pick up a tick right away, you can find a tick that's quite engorged, and those ticks may feed for a couple days and not know it and then drop off, and you never know that they actually were there. So in this study, the incidence of canine vector-borne diseases with suspected immune-mediated diseases was higher than in previous studies looking at overall incidence in a similar region. So in the previous studies, they were looking at both healthy as well as sick dogs. This study, we're only looking at dogs that were ill. And I think what that says to me is that if a dog gets exposed to a tick and gets exposed to one of these diseases, it's likely to get sick. We don't know what the time period is necessarily. And so, again, really strong tick control is really important to prevent these diseases. Owners should be specifically asked about tick exposure and canine vector-borne diseases investigated in dogs suspected of autoimmune diseases if they have a tick exposure. So that's really important if they have that exposure to follow up with that. Again, in this study, infection with Ehrlichia and Babesia was most common. Ehrlichias respond to doxycycline pretty well. Babesia does not. And so although the clinical practice of doing a doxycycline course to supplement immunosuppressive treatment is not particularly negated, but we have to remember that there are other diseases that are vector-borne that would not respond to doxycycline. Babesia can be very, very difficult, and so that is one tested for and speciated out. Although it really increases the costs of the diagnostics and treatment, if we want to have a positive outcome, that's going to be our best course of action. From a pet owner's perspective, we have to wonder, are these tests really worth it? And I'd say in certain instances, yes. Oftentimes, just treating with an antibiotic may make your pet better. However, this paper does demonstrate that ticks, particularly in Southern California, but potentially all over the place, do carry a high rate of infectious diseases, and a tick bite can have very, very serious consequences. And potentially spending a little bit of money at the beginning for testing may save hundreds of dollars down the road with medications, blood transfusions, additional testing that may have not been needed because we actually found the underlying cause of the condition early on in the testing process. So, by way of conclusions, the results of the study suggest that occult canine vector-borne diseases may play an important role in some cases of suspect autoimmune disease. And also, a lack of response to treatment in some cases of autoimmune disease may relate to occult canine vector-borne disease. As far as the specialist spin, if there's ticks in your area, do heavy tick prevention. If you see ticks on your dog, test for vector-borne diseases if they get sick. And that's this week's VetVine Specialty Update.